And special thanks to Petra, Natasha, Amy, and Jasmine for helping set up the session. And also like to really thank Gina, Hannah, Sarah, Joshua, John Norcross, many other people who've been involved in the work and research of preferences over the years. So this seminar is part of our CREST Research Centre seminar. And this talk is going to be about the kind of hows and whys of working with preferences, and just some of my latest thinking. Normally what we do is we have kind of primary research presentations, either research someone's doing or reviews of research, but this one is a bit different because I came in at quite short notice with all the coronavirus stuff going on. I hope everyone's well and doing okay through it. But what I'm going to do is kind of present a practitioner-friendly review of just some of the latest thinking that I've been doing about working with preferences. And it comes from a book that I've been doing. I don't think we'll record this one because it's coming out of a book that I've been doing with John Norcross on personalizing psychotherapy, assessing and accommodating client preferences, with APA Press, coming out later in the year or next year. It's been an amazing privilege to work with John. I'm sure if you know of him, he's one of the great minds of our field and one of the great writers and researchers as well, and has done has led on. I think it's going to be a fantastic book. The preamble to this really is that when we started on the pluralistic approach, we really put John, and particularly John McLeod, was really figural to this. We was putting the client's preferences right at the heart of when we talked about pluralism. And one of the criticisms we got, and Rosie's on the, I know she's watching, and I think Rosie, I remember, was one of the people saying, well, wait a minute, you know, isn't it the case that clients often don't know what their preferences are? And what about cases, for instance, where people say they want one thing, but actually what's going to help them is something else? And I think that initially that was a kind of critique that I was kind of put to one side and say, yeah, but we've got to listen to clients. But I think the more that I've thought about that and looked at that, the more and listened to clients and looked at the research, the more evidence there is that really is that as a serious critique. And I guess the challenge is to kind of take that on board without then throwing the baby out with the bathwater. It's a horrible phrase, isn't it? Throwing the baby out with the bathwater. God knows who thought of that. I'm not sure we should be using that anymore. But anyway, you know what I mean about kind of, you know, we want to listen to clients. I think we're all out there, whatever orientation, we want to listen to clients, but we also know the reality that clients don't always know what they need. Sometimes they ask for things from us as therapists that actually aren't the most helpful for them. So the question becomes then, you know, how can we think about this? And what I want to present is something from research and some other thinking about just trying to make sense of that and develop some nuances and some understanding. And I think a really good way into it is to start by thinking, okay, when we think about accommodating client preferences, then, assessing and accommodating, I'm going to talk about assessing, which is kind of asking clients about what they want, and then accommodating is the actual trying to give clients what they want. So when we think about assessing and accommodating, why actually might that be helpful? And I think there's an obvious answer to that, and I'll come on to that in a sec. But I think there's also some other important answers that perhaps are actually more evidenced. And I think if we can start by looking at why that might be helpful, what it is about assessing and accommodating that might be helpful, then we can start to think about, okay, in what situations and in what clients might actually that be of the most value. And John McLeod, who always comes up with brilliant things, he wrote a paper which is really worth reading on preferences, a kind of practitioner-friendly review of preferences. And one of the things that he talked about was about 3 different mechanisms of effect, if you like. One of which is matching effects, which is where we give clients what they want and they do well because, or don't do well because it matches what they kind of know that they want. And then the second is choice effects, which is about people feeling that they've got some choice in something. And then the third one is alliance effects. And I'm going to run through those and then think with you about what that might say in terms of where preferences might be most helpful. So let's start with matching effects. And I guess when we think about assessing client preferences, asking clients what they want in therapy, and then accommodating them or trying to accommodate them, that's the obvious one that comes to mind. Matching effect starts from the premise that clients probably have some idea of what works for them, or at least matching effect says, if assuming clients know what works for them, then if we can use that to guide the treatment and kind of match give them the thing that they're asking for, then that's likely to bring about positive benefit, because it matches and that they have some sense of what's going to work for them, or and that's a kind of hypothesized effect. Just to give you an illustration of where that happened, or rather where that didn't happen, comes from our clinic with a client called Jung-soo, obviously anonymized, young Korean dancer who attended about 13 or 24 allocated therapy sessions before dropping out. And what he said at the end point interview was that, well, the thing I found quite difficult was just the lack of structure. I'm not very open, so it takes a lot for me to talk, which is why I need someone to question me, or I don't know what I should be talking about. I know problems I have, but I don't necessarily know how to get around those, or how, solutions for that. Now, actually, Jong-soo's clinician was a training counsellor in his 50s called Ben, let's call him Ben, and they'd been asked to have assess and accommodate. So he'd been asked to work with Jong-soo's therapy preferences, but actually his capacity to do so seems to be been pretty limited. Jong-soo said, we did talk about it, so he did talk about it with Ben, and there would be a little bit more structure after we talked about it, and then it'd be back to talking about kind of random things again, and no structure. And after, I think, the second review, where I realized nothing was really going to change, that was in session 10, it wasn't Ben's style, it didn't really feel important, and Jung-soo dropped out fairly soon after that, because he just felt that the therapy wasn't matching what he wanted. Just to add to that, actually, one of the things that John Norcross particularly talks about is the importance of strong preferences. He would argue that whether it's matching on preferences or avoiding what clients don't like, the important thing is it's about where they strongly say, look, I don't want this, I want that, because you get those matching effects. And in that situation, that's not, of course, we won't talk so much about kind of what you do where you can't match clients' preferences, although that's maybe something people want to raise in the discussion. And we certainly talk about that in the book. But, in that situation, maybe Ben felt that he couldn't match those preferences, that it might have been better to think about a kind of on referral, and that's something we talk and about in the pluralistic approach. And certainly pluralism is not about trying to always match. And the talk is more about just trying to understand some of these mechanisms. So anyway, so if therapists can match, then there's the possibility of a positive effect there. But of course, it's absolutely dependent on whether patients, clients, their sense of what they want is actually what is going to be most helpful for them, and also, whether they both know it and whether they can communicate it to therapists. And there's a lot of therapies that would start from the assumption that actually clients often don't know what they want. Not just Rosie and other people. It's many of our kind of most cherished traditions would argue that traditional psychoanalysis starts from the assumption that our patients' deepest desires are unconscious, that they're beneath the threshold of consciousness. And in fact, some psychoanalytically based treatments, would expressly start from the perspective that what the client says they want. Actually, Yalom, who's an existential therapist, says exactly the same thing, that what a client says what they want is often an expression of their pathology, and actually what they need is the very opposite thing that they're saying they want. Somebody who's saying that they want guidance on direction actually needs to learn to live without direction. Someone who's saying that they can't cope, that the therapist has to be warm and supportive, cuddly, actually that's their pathology. That's the problem of not being able to bear something different. So in that sense, actually, person-centered would hold something similar in many ways, that they would say that what clients express at a verbal level, particularly when they come into therapy, may well be kind of their self-concept, but actually that the subceived desires, the deeper desires, are again beneath the threshold of awareness, and the whole point of therapy is to help clients access those things, the organismic things. And there was a paper recently on this by David Ong, I think it was, and related people saying about that, criticizing the pluralistic approach on the ground from a person-centered standpoint, on the grounds that clients often don't know what they want, and that's the whole point of person-centered therapy. Cognitive approaches too would argue that people can often misperceive their own experiencing, that they can catastrophize. So again, a client could say, I just can't cope with it unless a therapist is really warm. You have to be warm to me. And actually that kind of catastrophization, or that all or nothing thinking, is the kind of problem that they're struggling with. And it's not just theories, that there's good evidence for this, that David McClellan, influential American psychologist, distinguished between what he called self-attributed motives, so what people think that they want, and implicit motives, which is what they kind of really want at a deeper level. And it showed, and research has showed, that they're by no means the same thing. There's correlation of about 0.09. Recent research has shown there is some correlation, but it's fairly small actually, between what people are saying that they want and what seems to be they want, as assessed, for instance, by psychometric tests. Of course, it's difficult to know which is the right one, but one of the things is that's challenging for particularly a kind of preference accommodation perspective is that when you look at actual real world behaviors, that's more closely associated with the inferred motives, what other people are seeing in the person, rather than what a person says is their own motive. So again, it really challenges that idea that people know and are in the best position to describe what it is that they want. There's also research from the behavioral economics field, which also people like Daniel Kahneman have been very, very influential, that challenged, what's it called? It's not realistic conflict theory, it's another RCT. It will come to me at the end. But anyway, the kind of economic theory that says that people know what they want and basically make logical choices, and said that, you know, they talk about preference construction as the idea that consumers in the economic world are all the time making guesses and saying what they want, that often is very malleable, and isn't a kind of necessarily a deep-seated desire. And Liechtenstein and the Slovak state observed preferences are not simply read off from some master list. They're actually constructed in the elicitation process. So as you're asking someone what their preferences are, and in therapy as well, often it would suggest that that's the time in which they're actually thinking. And that can be affected by lots of different things. For instance, you know, if somebody, maybe the last thing that their therapist did was be really friendly to them, and it was a good therapy, that helped, but they remember that. They don't remember all the challenges and interpretations that went on before. You know, and then the classic demonstration of that is in what's called preference reversal, where you can get people to change their preferences depending on how you ask a question, how you phrase it, and depending on what's made salient to them. And the studies about kind of people being in rooms, particular smells make them want to do one thing. You know, lots of unconscious processes go on that suggest that people's preferences are very malleable, and that's something I think we've seen in our research, that something the clients themselves acknowledge, that their preferences can change a lot. And I'm sure as therapists, many of us encounter patients who's expressed, you know, particular wants or desires. You know, they've seen something on TV, about therapy. So, you know, they're saying that they maybe want, lie down on a couch, or they want to talk about something, and it's kind of related to things that they've seen very recently. You know, that is not about kind of reading off from some master list of deeper desires. So it's clear that when people say they prefer something, it's not necessarily an expression of what will be best for them. But as I was saying, you know, to go the other extreme and say, well, that means we shouldn't ask clients and preferences, doesn't take into account that the differences across clients, and that sometimes clients can know what they want. And there is research on kind of factors that vary, where people are more able to ascertain what they want, and that can help us develop a more nuanced understanding of preference accommodation. Because of course, you know, from a pluralistic perspective, which tries to avoid a one-size-fits-all approach, you can't say we should accommodate preferences, and with every client we should be assessing accommodate preferences. It's going to vary by different clients at different points in time. It's going to be more or less helpful. So kind of understanding what might be the conditions and the situations when clients may be able to match more or less is really important. And the key one that comes out in the research, I think, is what we call domain familiarity. This is if we think about psychology research, and this is you know, in the preference construction literature, for instance, when they look at the malleability of preferences, one of the things that they do straight away is that they focus on areas in which people don't know that much about, because they know that if people have a lot of familiarity with an area, then they're often much clearer about what their preferences are. You know, and it's kind of intuitively obvious. So say, you know, you go to a restaurant and like me, for instance, you know, Chinese food, Thai food, maybe Italian food pretty well. You know, I know when I go to an Italian restaurant, for instance, that I like pizza, I like pasta, I don't particularly like the liver and onions. You know, I have a strong dislike for liver and onions, and you know, if that turned up my plate, I would enjoy it less than something that I'm fairly certain I like. Not to say that, you know, I couldn't be pleasantly surprised, but generally I know. But you know, if I went to a Kazakhstani restaurant, where, and say even the menu's in Kazakh, then you know, somebody says to me, well, do you want the kazi, the kuridak, or the barsaks? Well, you know, I just don't know, and you know, I don't have any sense of my preferences, and if I state one, you know, I can end up with the kuridak, which is the heart, the chopped heart, liver and kidney, sheep's chopped heart, liver and kidneys boiled in oil, which, you know, I don't think I would enjoy that. I definitely wouldn't enjoy you know, because I just don't know that area particularly well. I don't know that domain. So if we think about that in terms of the psychotherapy domain, I guess the key point, maybe it's an obvious one, it actually took me a long time to realize this, but I think it's a really important one, is that someone who's got experience of psychotherapy is likely to have much more knowledge of what's going to genuinely work for them than someone who is a new client to the field. And certainly we've seen that with many clients who are new to the field in research, you know, that they will say things like, you know, when we ask them how is it to be asked about your choices, they'll say, well, I didn't really know because I'm you know, I haven't had therapy before. Clients who have had choices, who have had therapy before, are more likely you know, to say like this, not all, you know, no, absolutely not all the time, and you know, somebody can have years of therapy and still not know what they want. But I think it's a generalization that kind of domain familiarity with psychotherapy does seem to make a difference. And it's important to bear in mind, you know, I always thought about clients as kind of coming to therapy for the, it's like they see me for the first time, but actually there was some research I think showed something like clients have had maybe 14, I think it was some crazy amount of episodes. No, that can't be right. I think it was 7 episodes of therapy on average. So a lot of clients, and certainly that's very true for me, a lot of clients I work with have had therapy before and have had the experiences of therapy. And even if they haven't, you know, possibly they've had experiences with friends or coaches or mentors, so they've got some sense of what works for them or not. And that would make quite a difference in terms of their sense and their ability to match, internally match between what they want and what they think they want. I mean, I actually did. I was working with Jasmine. We were doing some research and just thinking about our own. I worked out that I'd had about 20 different episodes of therapy. I mean, in my head it was like about 2 or 3, but when I actually went through all the different therapists I'd had, it was, you know, it's quite an interesting exercise. If you ever want to try it yourself, like how many episodes of therapy have you actually had? You know, different therapists you work with. It's quite nice just writing that. I think we wrote it up on my blog actually. Because it was just an interesting exercise to do that, but it was a lot. Unfortunately, still hasn't helped, but maybe one day. Anyway, moving swiftly onwards. So, domain familiarity. You know, when we think about matching effects, knowing ourselves. Knowing therapy, knowing how therapy works, what it is, having that familiarity with it, seems to be an important predictor of whether clients are going to be able to kind of know whether that's going to be an important mechanism. But there's also other things when we think about matching effects. So one from the thrash was like some people are more self-determining. They kind of regulate themselves generally more in terms of their intrinsic motivations, internal motivations. Other people are more externally determined. And again, maybe that's an important factor. There's some research that shows that where a person's early environment supports the development of self-determination, that might also lead to more motive congruence, people knowing more what they want. And of course, a lot of our clients don't have that. They don't have that environment that supports them towards self-determination, which is why they're often coming to therapy. But if they have had that, and as with many things in therapy, I guess that's to some extent the rich getting richer, and people who are functioning well, unfortunately, well, not unfortunately, but it means that the ones who are poor functioning often are least able to make the use of therapy. That is something that's very clear there in the research. that is perhaps also an important factor. They also found that people who were high emotive congruence were people who were more sensitive to their bodily state, so they kind of people who knew what was going on in their body a bit more. Less monitoring of other expectations, which I guess is similar to that thing about self-determining. And also people who are more concerned with self-consistency. So people who are more self-consistent, and maybe that's more of an artifact of research, but people who more wanted to be self-consistent tended to be more consistent between what they said they wanted and what they actually wanted. So just to draw that bit together, so it seems reasonable to assume that one of the principal ways in which preference assessment accommodation could, and I really emphasize could, benefit clients is by increasing the likelihood that they'll receive treatments that genuinely match what's most helpful to them. And that therefore those who know the most about the psychotherapy may be most likely to have that kind of motive congruence. As I say, it's not always the case. And it might be that, many clients, as I was saying, who've had years of psychotherapy may not know what they wanted. And clients may still go down the wrong track. They may still be asking for things after years and years of therapy that are actually not helpful for them. But I think one of the things to bear in mind, what the research shows, and sorry, I should have said this earlier, what the research shows is that generally where there is preference assessment and accommodation is associated with better outcomes overall. Particularly one of the things is around dropout. It does lead to reduced dropout. And one of the things is that, even if, say you take John Su, even if actually John Su was better off with a very non-directive therapist who really sit with him, tolerate that space for him to go into the fears and the terrors of what it's like not having direction and actually bear that. Ultimately, perhaps that would have been the most helpful thing for them. But what we know from the preference research is that where there isn't that matching, where there isn't that accommodation, that the risk is much higher, almost twice as high, that you get dropout. And of course, if a client like John Su is dropping out, then he's not going to be around to experience the benefits that a therapist, a non-directive therapist, might be able to provide him. So there is that careful matching, and maybe there's a kind of shifting that needs to happen over time. It might be one way of thinking about it, that initially, particularly with strong dislikes, maybe it is important to avoid that to some extent until the alliance is built up, and I'll come on to that in a bit, where then there can be more of a building up of the relationship again. So that's the first thing, and I'm just having a look on I'm on a different screen. I'm just having a look at this different screen, see if anybody is saying we can't hear a word Mick's saying, or no, it looks like it's okay so far. Okay. Fortnight versus preference seminar, tough choice from Johnny Hutchinson. Thanks, Johnny. Okay. Pleased to say my son's not watching us here and now. I suspect he said that he's playing some offline game, practicing getting better. He's so good at this game. I can't beat it. When we play this game now, Balloons Tower Defense, there's like about 20 different indicators about who wins, and he has to beat me on every single one to win, because if I can just beat him on one, that's as bad as I'm getting. Anyway, choice of it. So matching is one way in which we can think about how preference accommodation might be helpful. And then the second thing, which actually I think there's more evidence for, the research is around choice effects. So what we're talking about in terms of choice effects is about the impact on clients of feeling that they've had some say in and control over how the therapy is delivered. So this isn't about actually clients getting what they're asking for. It's about being asked, and I guess this is more about preference assessment and accommodation. It's about being asked what they want and feeling, well, okay, I've got some choice in here. There's a very interesting study that has shown this, and as I say, it's well evidenced, these choice effects. It was by Handelsatz and Keenan, and what they did is that they looked at students suffering from test anxiety, and that they were asked whether they preferred progressive muscle relaxation, which is kind of a relaxation exercise, or a cognitive behavioral modification technique. And it was under three conditions. One was just a waitlist control, so we'll forget about that one. Two main conditions. One is that they were allocated to the treatment that they preferred, and they were told that they've been allocated to the treatment that they preferred. Now, in the second one, they were also allocated to the treatment they preferred, but in this one, they were told that allocation was just random. and that it wasn't on the basis of what they'd said. So in one, they were told that their choices had been taken into account. The second one, they were told that it hadn't, that it was just random, and they ended up with the same treatment. So it couldn't be due to matching effect. And what the results showed is that the ones who had been told that they'd been given the treatment they wanted showed better results than the ones who were told that that they were given the treatment by random. So that really shows that experience of having choice in itself can have a positive effect. It's not clear whether it's long lasting, but there is clear evidence of efficacy. And they've done studies the other way around, where, for instance, people don't have a choice, but sometimes they're told that they do, where they don't actually have a choice. It is random, and sometimes they're led to think that it was their choice and others. And again, it kind of shows a similar thing, that the perception of choice can have a positive impact. So why might that be the case? Well, the first thing is that the perception of choice can kind of bring about positive affective responses. And the research shows that the act of choosing is associated with increases in positive affect and the activation of dopamine reward mechanisms in the brain. There's clear physiology that that the act of choosing, or potentially also the perception of having a choice, can have a clear positive effect. And numerous lines of research also show that feeling in control can reduce stress, leads to positive benefit, can help people feel less helpless, more self-efficacious, which is obviously very important in therapy. I mean, some theorists would say that a sense of control is perhaps one of the most fundamental human needs, and that we all need very deeply a sense of control. And it does seem to transpose to the therapeutic domain. So work by a PhD student of ours, Adam Gibson, some very interesting work, for instance, found that around half of clients described the experience of shared decision making as empowering, and generally they described it as a positive development. Desmond, the client in the Crest Clinic, said of collaborative working, he said, well, it gives you a bit of power over things that have caused you pain. And obviously, if you're in therapy because of them, you feel powerless, and you continue, you've owned the situation, you've owned what someone else has made you feel so shit about. Yeah, so it's important. So there's something about where you're offering clients some choice about how would you like therapy to be, that they can feel a sense of ownership, and that they are empowered in therapy. And feeling empowered generally, and I'll come on to some moderators of that, is a good thing. But there's also something about, so making choice can feel good, but also we know really from the cognitive dissonance research onwards that what can happen is that when people make a choice, they feel more positive then about the choice. They've done lots of research. People have a choice between washing machines, and choose one washing machine. Then you ask them which one they like, and they actually like that one more afterwards, because in many ways they're self-justifying. There's different theories, whether it's how they perceive themselves, or perception theory, or whether it's because it reduces a kind of emotional state of cognitive dissonance and regret. But clearly that's a very, very well established effect. Now, people like something more. So a client who's given a choice and feels that they may have chosen something, and then likes it more, may then become more committed to it, more willing to engage in it, more participatory. And if that's the case, those are factors which we know are very strongly associated with positive effects in therapy. Probably the best predictor of good outcomes in therapy is a client's level of participation and engagement. So anything that can do to enhance that, which could include feeling like you've chosen that therapy, is likely to be a positive thing. But again, it's not simply the case that the more choice, so even if we take those two factors, and probably actually we could analyze them separately, but analyzing them together, it's still not the case that kind of the more choice in therapy is the better. And actually there's research that shows that the presence of choice can make no difference to psychological outcomes in certain circumstances. In some other circumstances can have a negative effect. So again, we can go into these choice effects a bit more and think about, okay, when might choice be a good thing and when might it not be, and what can we learn from the psychology research? And again, one of the factors that comes up very strongly is domain familiarity. That where people feel that they know about something, then they feel more empowered when they have a choice than when they feel that they don't. They did a study with exercise bikes. And people could choose an exercise bike program, and they compared. What they found is that there was a choice effect, but it was only for those who were familiar with exercise bike programs. So those who had no familiarity having a choice didn't make any difference. So maybe there's something about if you feel comfortable and in control, that if you have experience in a particular area, then you're more likely to feel comfortable in control when you've got choices than if you don't. If you don't know what Kazi, Kadak, and Bersaks are at your Kazakhstani restaurant, then being offered a choice, is it going to feel good? Probably not, actually. It's probably not going to feel very meaningful. What you want is you want guidance. You want someone to sit down with a menu and say, well, this means that, that means that, that means that. And probably frustrated when you don't get it. Choice without understanding is not going to lead to positive benefits. So this kind of adds weight to that suggestion, really, that when we're thinking about our clients and assessing preferences, that for clients who've had some experience with therapy, that is probably going to be the key mediator. I mean, in fact, I sometimes wonder whether when we think about preferences, in some ways, maybe the best question to ask clients in the first session is, assessment session is, have you had therapy, and to talk to them about, have you had therapy before? What was that like? What was helpful? What wasn't helpful? That might actually be a better way into client preferences than questions around preferences per se, because that's probably going to be so telling and informative about what works for clients or not. And in my experience, where clients say things like, well, I had a therapist before who was very, didn't say much, and I found that really frustrating. That those are the kinds of preferences that seem to have the most consistency and seem to be most robust, and generally tend to be there throughout the therapeutic work. It's rare that clients, where their preference is based on previous therapy, say that I wanted that because of past therapy, then that gets changed less often. And I think there's something there about more robust choices. So that's one thing, again, to my familiarity. Now, another one is about the kind of number and the complexity of choices. That even even with pizza, if I go into a restaurant and I'm presented with a kind of mile-long menu, although actually a lot of Chinese restaurants do have these kind of mile-long menus. Sometimes it's okay, but if there's too much, particularly this, at least with that, I'm kind of mainly vegetarian now, so I, look at the mixed stuff, I can discount that. But there's loads of gorgeous food on a menu, then it just it's too much. It does my head in. And I think the same, we know there's research that shows when clients are kind of presented with an overwhelming number of choices. Yalom talked about alternative excludes, the fact that choice is anxiety evoking, because when we choose one thing, then we have to exclude other things. So there's something about the number of choices. There's probably an optimal number of choices, not too many, not too few. And probably the same is true for psychotherapy, that where we're working with clients, that just giving them a blank sheet of paper and just saying, what do you want? More and more I realize that's not helpful. Sarah Cantwell, who did some research, PhD with John Ray and Jack and others of us here, talks about kind of scaffolding, and I really like that idea of being able to scaffold choices for clients. So we're maybe talking about maybe two choices. Would it be helpful to maybe, you said that you want to talk about your childhood, we could do that by just having an open space where you can say whatever you want, or we could do that by me asking you questions. So there's clear options. And in the literature on shared decision making as well, it's in medicine, there's a lot of research to show that kind of scaffolding by doctors is much more helpful generally than just the kind of blank sheet. Of course, there's a danger it can be leading. What if clients want something outside of those choices? But generally that seems to be a good strategy, is to scaffold choices rather than to leave it completely open. So there's also something about the kind of importance of choices. And again, what the research has shown is that where choices are important to clients, then having choice is valued and has a positive effect. But actually, where clients don't really care about choices, then having choices doesn't lead to any positive benefits. And so, for instance, if you're working with a client who, so what that suggests, is that choice effects may be present in psychotherapy to the extent that clients feel that it's important to have a choice, and that it will impact on their treatment. So if a client feels that they're being given choices, but actually the therapist is going to do what they do anyway, then that's not going to have much of a benefit. And they've got to also kind of feel that those differences are meaningful. And maybe, again, domain familiarity, maybe for clients who aren't familiar with therapy, that's quite a tough one to actually feel that those choices are going to make a difference, particularly if they don't know what the choices are. But if a client feels that they're being asked their choice and it's important what those choices are, then that has the potential for a much more positive benefit. Now, sorry, I'm just going to go on a bit because I do want to finish by 10:02. But another one which I think is really interesting is desire for control. What the research shows is that some clients and some people do have more of a desire for control, that they like to kind of be in control of their lives, tend to be more assertive, decisive, active. Some people aren't particularly bothered about being in control. They like to go with the flow. They like things they're quite relaxed about things. They don't need to have a lot of control over things. I'm sure we all recognize that. Again, it's kind of fairly obvious, but it may be important to recognize that a client who likes to be in control is probably going to experience more positive benefit from, or more positive affect, at any rate, from being given different choices. Someone who's fairly relaxed, those choices may not be particularly important to them. And just one thing to say about that is that that those choice effects and the matching effects might actually be quite independent. So you might have a client, for instance, who, for instance, it's not really important for them to feel that they have choice, and it doesn't have a particularly positive effect. So saying that they want something doesn't actually make them feel any different. But actually they have a fairly good insight into what works for them, and that by saying that and getting that therapy, that they get good matching effects. Or you could have it the other way around. So these are potentially different effects, and could affect the client in potentially different ways. The third thing that I wanted to just talk about is alliance effects, which I think is is the third pathway that John McLeod talks about, how preference might affect people's well-being. And this probably shows more effect, whereas the other two maybe are independent. This probably shows more overlap with both the preceding mechanisms. Although it's probably more indirect in terms of how preference, assessment, and accommodation might lead to positive outcomes. And what we're talking about here is, firstly, the way in which offering clients choice can help them feel a stronger bond with their clinician. And then also on the agreement on tasks and goals. If you know Bordin's definition of alliance, bond, task, and goals are the three parts of it. And potentially preference, assessment, and accommodation could impact on both. So in terms of bond, we found, Adam Gibson found in his work, that around half of the clients were saying that shared decision making, talking about their preferences, helped them feel more listened to, understood by the therapist. That it was seen, one client said, it was clear that the therapist had been listening, which was kind of quite cool, and get my preference. Being asked what you want, and certainly, if I think about being at the doctor's, or a restaurant, when I'm asked what I want, generally, if it's done in the right way, and I'll come on to that in a sec, then it can have an impact on the bond. And clearly also it can lead to more agreement on the task and goals, almost by definition, because it helps more alignment between an understanding between what a client wants and what therapy is delivering. Goes back to those matching effects. But having said that, I think it's very much bi-directional, and that's really important to bear in mind. That you could be given choice, but it could be done in a very unbonding way. You've probably been into a restaurant, maybe it's kind of the evening's dragging on, and they're about to close, and you get kind of thrown a menu by a surly waiter who's hoping to shut up shop for the night. Choice doesn't necessarily have to be preferences doesn't necessarily have to be in an alliance forming way. You could ask someone in a very cold way, what do you want here? What do you want? It doesn't have, you could ask, I'd be really interested in knowing what your thoughts are about psychotherapy and what might work for you. Do you have any sense of what might be helpful or not? And, maybe we can work that in. I think that'd be a fairly warm way of asking it. You could also say to a client, what do you want? It's up to you. So, and I would hazard a guess, actually, and I might be wrong here, and again, it might be about independent effects, but I would hazard a guess that actually the alliance effects probably overrule the matching effects and the choice effects per se. That I think probably where preference assessment and accommodation has its biggest impact is in what it means for the alliance, particularly relational depth, the bond. I think that's really important, and I think if it undermines that, then that's not going to help anything. I think that it's where it contributes to that and where it becomes part of that, and it's really woven in. So that, and that's what I find, and that's, you know, I love working with preference assessment and accommodation. That's something that John Norcross wrote in our book beautifully about. Just, you know, it's a really nice way of working. But really it's because it's threaded into the alliance, and it's about forming this collaborative relationship where you're kind of working and testing things out and checking things out and inputting. And it's something about, I feel more real in that. I feel like it's more of a dialogue, and it's something about the dialogical nature of the relationship that builds up because of that work. Probably often in many cases more than the matching effects per se, possibly, unless they're very strong preferences. John would say, John Norcross, you know, his strong preferences, strong dislikes, that's going to make a difference. And I think that's probably also true. And again, maybe there's something about the independence of these effects. You know, they're kind of orthogonal, or they could be orthogonal. At least they could be orthogonal. So just to conclude, you know, Arnold Lazarev, founder of technical eclecticism, which is great therapy. If you don't know about it, wonderful therapy. So that it'd be naive to assume that patients always know what they want and what's best for them, and that clinicians are those advised to slavishly follow their client script. So I think, as I was saying earlier, psychotherapists, we need to find a way of navigating between a kind of paternalism where we just get on and do it how we think without asking to clients, versus a kind of approach which is just handing everything to client. And I think, as I said before, you know, for me the key is dialogue, relationality. Inviting clients to explore their preferences, exploring with them what it's about, the background, rationale, robustness of their choices, sharing our views, reviewing and revisiting everything. But what we know is that, you know, what's important to come back to is that somewhere along the line, preference, accommodation, and assessment is capable of making a big change to clients. We do know that from the outcome literature and from the meta-analysis. So clearly something is possible. And the challenge really is to find out more and more about what it is that is driving that, what's causing that, and then to build on that. And maybe those are the important things. And understanding that and being able to develop that and nuance that and improve that, so that we can really work with preferences in a way that maximizes their benefit. And of course, here I'm just talking about outcomes, really. I mean, there's a whole other side about the ethics of preference assessment and accommodation that I haven't talked about, and that's another reason why to do. I mean, some people argue that whatever the outcomes, we should be doing it because it's about consent and about working in an ethical way. But I think in terms of outcomes, understanding these mechanisms, understanding these individual factors is really important, and it is core to, of course, a pluralistic practice, and is really at the cutting edge of preference work. So I hope you found that interesting. I'm not sure how we're going to do this next bit. I've got the live chat on. If people have got questions or comments, maybe people could put that on the live chat. I know there's been quite a lot of dialogue, but sorry, I just haven't followed. Wow, that is a lot of really interesting dialogue, but I just haven't followed that. It was enough trying to get over the trauma of not being able to set this up properly, which I apologize for again. Petra says, we have two questions so far. One from SciTech about where internal evaluation, external locus evaluation fits in. Yeah, that's a great question. Sorry, I thought I'd mentioned that actually, but if I hadn't, I might have skipped over that bit. So I think that particularly comes up around choice effects, and where it's relevant around choice effects is that people with, no, sorry, not choice effects. It's matching effects, sorry, apologies, matching effects. I knew I'd got it somewhere. In matching effects, where people have a more internal locus of evaluation and tend to kind of know themselves, kind of tend to lead by themselves better, those clients tend to have a better sense of what's going to work for them. And probably with choice effects as well is also important for them. Someone with an internal locus of evaluation, I think, is more likely to benefit from preference assessment accommodation. Someone with an external one probably is more likely to want the therapist to get on with it and not to have too much extended dialogue about what it is that they want, because they'll be looking for the therapist to lead. And again, but there might be important processes of, again, you get here into kind of preferences about preference work, and potentially again whether a client's preference work is what actually they need. So you might have someone has a preference not to do preference work, but actually what they need is preference work. It gets complicated. Thank you. Yeah. What other questions have we got? Petra, can you let's have a look. Assuming that clients know how to articulate preferences, assuming that clients have the tools and knowledge to articulate their preference. Yeah, it does. And I guess that's another important factor, is about helping people, looking at where people might be able to articulate their preferences, because it's both about knowing it, but also about communicating it. And that's maybe also to do with assertiveness, confidence and communication. There's a whole range of other moderators there that may be really important. How do you introduce the client preference form? It is very long. Karis, I'm not quite sure. Do you mean the inventory of preferences there? The client preference form is something different. The inventory, the Cooper Norcross inventory preference itself is about 20 items. And so that shouldn't take too long. I mean, most clients do it in about 3 to 5 minutes, and then we talk about it. But they don't fill in all the bits, the open-ended bits, and then we go through it with them. What type of, Kat says, what type of preference choice do you mean? Well, there's a whole literature on different types of choices. So there tend to be treatment choices, which is about, do you want CBT person-centered? Then you've got therapist choices, which is what kind of therapist would you like to work with? And then what you have is method activity choices. So how would you like the therapist? But I've mainly been talking about activity choice. That's the bit I'm most interested in, working in a kind of pluralistic, integrative way. But there's quite a lot of literature, and then that's kind of mainly around kind of the method, but also goals, etc. Annie, I prefer to think about it as collaborating with the client to work out together what will be helpful, giving them a choice. Asking them to choose can feel like a pressure. Can also make therapy feel like something you purchase. Working together feels more relational. Okay, working together is another way to talk about it. Questions. Rachel says, Jen talks about therapist awareness, that they hold the power of distraction, especially at the start, and have the ability to pull clients away from their own self-propelled feeling process. Okay. Petra says, how do you introduce the client preference form? Well, the CNIT, the inventory of preferences that we've developed. I mean, what I would do in assessment is first I would talk to clients about what's brought them here and what's brought them into therapy. And then we would go on to talk about what they want from therapy and maybe goals. And increasingly, I would maybe avoid that language. And then somewhere I say, well, okay, so, you'd like to work on this, and it sounds like this is where you want to go. Do you have any sense of what might be helpful things to get there? And as I said, I might also introduce it in terms of, if you had therapy in the past, what's been useful for you? And then I'd say something like, well, there's a form that can help us think about that in a bit more of a structured way. Is that something that you'd like to do? And if clients say, yeah, give them the form, they take a few minutes. Generally, we found that clients like doing the inventory preferences that we've developed online. And if you go to my website, it's probably the easiest. You can see the link to it, and there's an online version of it you can download. And generally, clients generally say that they find it a positive experience on a 1 to 5 scale, where 3 is neither helpful or unhelpful, 1 is very unhelpful, 5 is very helpful. The average is just above 4, I think. So clients generally seem to like it. Mike says, preference assessment a conundrum. How do clients know what they want is actually what they want? Exactly. I guess that's, but it's a conundrum, but also an important one to work with is, and I think from a pluralistic standpoint, we need to avoid falling into either the position that clients, what clients say they want is what they want, but also the opposite of what clients say they want is irrelevant. I think the answer lies somewhere in between, and it's different for different clients at different points in time, which is very much the essence of a pluralistic standpoint. Let's have a look at some. So where can I find this literature coming on Sunday? Yeah, if people are interested, actually, just to say, I'll be doing a workshop on Sunday, and if you go to Mick-Cooper co.uk, then you can see details of that on the forthcoming event. And I'll be talking a lot more about this area of pluralism. Rosie, do you think there's a danger that inviting client preference sets up an expectation that we can be all things to all people? Is this a potential for impacting on our authenticity as therapists? As always, Rosie asks wonderful questions and makes wonderful point. Yeah, I think absolutely. There is a risk that it communicates to clients we can be whatever they want. Although, actually, having said that, it's not tends to be what clients say particularly that they then get disappointed. I think it's, yeah, not so much that that's come up. I think that it's often the therapist, what therapists is something I said, and talking about working in a pluralistic way as well. What therapists have said is that sometimes they feel that they have to be all things to all people, and then that is a pressure, and actually that can take them away from doing their best work because they feel that they have to juggle lots of things all the time, have to be this and have to be that. So it's really important, I think, with preference assessment accommodation. I think this is something I've realized increasingly. It's really important in training about it and teaching about it, to emphasize that it's not just about saying to clients, right, what do you want? Okay, I'm going to do that. It is more nuanced. But I think, as I said before, I really believe this, that the challenge is to find a nuanced, sophisticated way of doing it that navigates between both asking and engaging with client preference, but also not complying. Because I think it's far too easy to kind of raise criticism and say, well, clients don't really know what they want, or, you know, it sets up their expectation, therefore we don't need to worry about it. You know, and in some ways that's more comforting. You know, William James said pluralism makes for a messy universe, and it is messy. But I think that there's, you know, I've talked about the research, but I think there's also an ethical responsibility to respond to client preference, and it's tough. You know, it's tough. It's tough because it's tough because it's complex and because there aren't easy answers to it. Right, I'm just picking out some here. Anna says, this raises a question about the type of language you use and its compatible with the client's language. Yeah, absolutely. And then Rosemary, yeah, someone else has said, Will McCon says, psychology of rugby. How does preference interact with the psychologist's competencies? As in, is their preference is for support beyond what? Yeah, so it's really important when, you know, when we're offering choices, that it's within our competency. I mean, that has to come first, and it's not about trying to do things, as I was saying before, that are outside our competencies. One of the things that I'll be talking about on the pluralistic workshop, and I really emphasize, is about therapists recognizing and thinking about what it is that they can offer, what's their kind of scope of practice. And John and I write about this in our book, this idea of kind of scope of practice. And I think we all have a scope of practice, you know, even. And that might be about, sometimes that is about being able to offer different interventions. But sometimes, even if I'm, you know, even if I just work in a purist approach, and a pluralism, you know, there's a massive misunderstanding about pluralism that says, you know, we shouldn't work in a purist approach. It's absolutely fine to work in a purist approach. You know, even someone who works in a purely person-centered or CBT or psychodynamic, there's still a scope of practice. You know, that if I'm person-centered, I can still be more or less kind of forward-leaning and more challenging or less challenging, depending on what a particular client wants. If I'm working psychodynamically, I can work maybe more with transference interpretations, or maybe more with the client's past. That there's a scope of practice that, and so preference is about kind of knowing where we can modify, where we're willing and relaxed about modifying or able to modify, and then seeing where the client's preferences can inform that. So it's not about going beyond our scope; it's about being informed in our scope. Nina Ruff says, what are your views on matching cultures, client therapy? How important is it? Yeah, that's a really important question about kind of matching on cultures. And again, John's talked about that in this book. I mean, the research shows that clients from marginalized groups do tend, on average, to express preference for therapists working with therapists from those marginalized groups. And the outcomes can be better, although once you control for feeling accepted, then those effects tend to be less pronounced. So it's something about feeling accepted by someone in your group. But certainly matching on cultural background is something that is really important. And when we've got our inventory of preferences, that's something that we ask. Although, again, it's about what is the scope within a service at that point to accommodate that. But you know, that ability for clients to match on ethnic preferences is really important. Just one other thing to say on ethnicity is also that there may be ethnic and cultural differences in how important preference accommodation is. There's some research, for instance, that shows that clients who have a more interdependent sense of self, so see themselves as more relational, have less choice effects than clients who have a more independent sense of self. And you can imagine why, with things like kind of locus control and the importance of choice of person, that also having an independent sense of self might also predict more preference effects, where somebody who's maybe from a culture which is more interdependent, sorry, more relational, maybe the choice may be less important or maybe less relevant to them or consistent. And I think that's jealousies. I think it also depends on the issue. If the client has experienced oppression from people in a group. So we're up to 7 o'clock. Thank you very much for joining us. I'm really sorry about the chaos of the technology. Now, just the last thing that I wanted to say is that we're going to the pub. In our CREST seminars, we always go to the pub, and we're going to try and do this. We're not really going to go to the pub, but I certainly need a drink after all the technology problems that we've had. And I'm going to put, if you want to come and join us, just go to that Zoom link. I'll put it in the chat. And then you're very welcome to come and join us. Just have a chat. It's going to be very informal, very relaxed. Just chance to just chat informally. Might talk about seminar, don't need to. Just before we go, I'd like to say thank you so much again to Petra and Natasha and Amy and Jasmine and everyone who was involved in setting up the seminar. We have more CREST seminars coming online. Hopefully it won't be quite so chaotic. I think we know what we're doing now, or at least we're not going to try and do this again on YouTube. I will leave that to the 14 and 15-year-olds to be the YouTubers in future. But thank you so much for everyone setting this up. Do come and join us again, and you'll see the links on the Roehampton CREST page, and we'll also distribute them on other pages. I don't know if Petra, do you want to just say? I'm not sure we know what the next seminar is, because we just need to check people are willing to do it online. But do come and join us CREST seminar, and hopefully it won't be too long before we can do it face to face again. So I hope everyone stays safe, and thank you very much for joining us for this CREST seminar, and maybe see you in a pub in a few minutes. Do get your drink, and watch out for Edith. Edith steals everyone's peanuts, so watch out for Edith. But otherwise.